Let's begin with urinary tract blockages, which can be quite serious. Treatments are often invasive and uncomfortable, but there's also a long-term alternative we'll discuss. Please welcome Dr. Nir Kleinman. Could we start by looking at how the urinary system is structured and its main parts?
Sure. Quick anatomy lesson. The urinary system includes the kidneys, which produce urine. The kidneys sit in the lower back, and from them, two thin tubes called ureters carry urine. The ureters are delicate tubes that transport urine from the kidneys to the bladder, which stores it until you go to the bathroom. The bladder is located down in the pelvis.
Blockages can form in those thin ureters, causing serious issues, right?
Since the ureters are very thin and delicate tubes, they can get blocked for various reasons. This might result from treatments the patient had before, like radiation. Invasive treatments can lead to internal narrowing inside the ureter, or sometimes tumors press from the outside, squeezing and blocking it entirely, causing significant obstruction.
Up until now, what kinds of treatments have been available for this problem?
So once the ureter is blocked, high pressure builds up in the kidney, damaging it, so it can't be left like that. The kidney needs to be drained somehow.
By the way, how do these patients get to you? Like, what symptoms do they feel at home?
Usually the patients either feel pain or the imaging tests show that the kidney is swollen, and lab results reveal worsening kidney function.
One of your innovations is a stent, right? We usually hear about stents in heart attacks where they put a tiny support to keep arteries open. How do you treat a blocked artery in urology? Can you explain the process briefly?
So in most places, or at least until fairly recently, the common and standard practice was to insert a tube called a nephrostomy. This nephrostomy tube is inserted from the outside into the flank, and it actually drains all the urine into an external bag. As you can imagine, this really impacts quality of life. Walking around with a urine bag, which can get infected and needs to be changed every 3 months. Not an ideal solution. Another option is to insert an internal tube called a stent. You can see it here. Show us, please. Yes.
Please, is it this tube?
Yes, this particular tube runs from the kidney down through the blockage all the way to bladder.
It's very flexible, right? What is it made of?
It's made from various polymers, silicones, etc. It's a hollow tube with many holes, allowing urine to flow from the kidney to the bladder and clear the blockage. The problem, as you see, is that this tube has loops. That means
It's not clogged, it's hollow inside.
there are small holes here. The problem with this tube, the stent, is that the lower end sits in the bladder and rubs against it, which harms quality of life. People experience significant damage, frequent painful urination, blood in urine. Many rush to the bathroom, often in severe pain.
So what's the innovation?
This is a stent that's been around for years called the Aluminum stent. You can see it here. This stent, you mentioned cardiologists earlier, is very similar to the cardiology stents. It's not even stiffer. The advantage of this stent, the advantage is that it's soft. It doesn't have a part that sits inside the bladder. It's a stent that's placed in the system and expands like a spring at the blockage. It widens the blocked area and keeps it open. The big advantage, as I said, is no complaints like with traditional stents because there's no part that sits inside the bladder. It greatly improves quality of life.
Does it also improve success rates?
It can also do that as well. Studies have shown that it effectively solves the problem by healing strictures, and it basically cures them.
Are there any risks?
Look, it's a minimally invasive procedure. It's quick, about 20 minutes, and has very low complication rates.
And regarding recovery, when can one return to normal?
Immediately, you can actually go home that very same day, no delays at all. That same day and back to work.
So in your view, what's the change with this advanced stent?
First, the stent significantly improves quality of life. People can exercise. It only needs to be replaced once every 3 years, unlike the other stent, which requires replacement every 6 to 12 months.
Wow, that's huge.
And people, like I said, see a big quality of life boost and can exercise.
And it suits all cases, even men.
It's also for women, suitable for men, women, reconstructed urinary systems, and transplanted kidneys.
You mentioned success rates and risks. Is this new stent really the breakthrough that will replace the older models we've used for years?
I believe so, not just the next, but the current solution.
So who exactly makes the final decision on whether the patient receives this new stent or if they'll go with the older model?
That's the urologist discussing it with the patient.